let me ask you about monkeypox. We've been hearing from some very brave people willing to talk about what it's been like for them getting infected. Here's a gentleman named Matt Ford who spoke this week to our colleagues at MSNBC. Watch.
I had really intense flu-like symptoms pick up, and then I had lesions appear all over my body. At its a peak, I counted more than 25 all over. It took me 3 weeks to fully recover. It was quite a long isolation time.
Dr. Adalja, I've heard horror stories from people who have gotten lesions and sores on their private region that has made going to the bathroom excruciatingly painful. I believe passing glass was the way that they described it. Sorry to be graphic. I don't understand why the U.S. government has not flooded the nation with vaccines yet. Why are we still waiting for vaccinations?
I think this is a result of the fact that we just didn't have so much of that second-generation smallpox vaccine, Jynneos, around because nobody ever intended it to be used during a big monkeypox outbreak. And what we've seen is a lot of bureaucracy mobilizing doses that were available. For example, it took some time to get doses that were made in Denmark, that were already approved by the EU, to come to the United States because there's a lot of allegiance to bureaucracy, which is, I think, getting in the way of actually doing what's right and what's needed for this outbreak. And I think we have to hold the federal government account for not making vaccine available as quickly as possible. I think they've also been resistant to prioritizing first doses. That's something we should be doing with this 2-dose vaccine. And I think we also have to think about using the older smallpox vaccine in populations that can tolerate it, that don't have any contraindications with some counseling. I think we really have to be aggressive because the reason why this is so bad is because we've not taken a very proactive approach. It's been very reactive, which is dismaying because it's coming after COVID-19.
What would you tell, particularly men who have sex with men, until vaccines are available? There's a very large event in San Francisco this weekend, the Up Your Alley Street Fair, formerly known as Dory Alley, where a lot of people are going to be gathered in one place, and there are a lot of vectors for infection. And I've lived in San Francisco. The community is extremely good at taking care of itself. But until more vaccines become available, especially for people in my community, what would you suggest we do while we're clicking and clicking and clicking on the appointment website trying to get in?
I think the best thing to do is remember or be cognizant of the fact that this virus is spreading amongst the community of men who have sex with men. It can infect anybody, but you can't deny the epidemiology that this is really concentrating in that group, and it's taking advantage of network effects and big kind of amplification events. So be very wary when you're in close contact with each other and make sure that you're practicing safe sex as best as you can. It's something that's going to thrive on close contact between each individual. It's not spread like a respiratory virus, so it's the close contact you have to worry about. And maybe decreasing the number of sexual partners, trying to be cognizant of who's vaccinated, who isn't vaccinated, who may have symptoms that could be consistent with monkeypox and who may not. All of that's going to help reduce the harm this virus causes until we get enough vaccine into that at-risk group.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.